Every day is a whirlwind of new faces for consultant obstetrician Ed Neal. From expectant mums to tiny premature babies, an endless round of hand washing and hygiene goes with the territory. But now Mr Neal has a new look to help him fight the superbugs at Bedford Hospital. Gone is the white coat, the long-sleeved shirt, the watch, the tie. Instead, he is bare below the elbows, a strange feeling after all these years.
I'm really not used to not wearing a tie. I even put it on to come to work. I take it off when I get to work, when I take my jacket off, and then I put it back on again to go home. With our bare arms, we're not going to be frightened of getting our wristwatches dirty or wet. We're not going to have cuffs that will touch patients and then touch the next patient and the next patient. And when was the last time anybody washed a necktie?
The iconic image of the doctor in the white coat dates back to the 19th century. It was originally introduced to prevent cross-contamination, the idea being that the white showed the dirt. But studies have shown that a quarter of those coats carry serious bacterial infection, and the cuff area being a particular problem. Last year, Bedford Hospital struggled with outbreaks of the infection C. difficile, up to 20 a month. That's now down to just 4. Across our region, other hospitals are also implementing changes to their uniform policy. Anyone who deals with patients must comply.
I think any change that can avoid any sort of infections in the hospital would be brilliant. So, yeah, very good idea.
The consultants' uniforms are more relaxed than some of the midwives, and I think it's easier for them to work than it would be in a sort of full dress uniform.
The battle against superbugs is far from won. No doubt the weapons will change again and again, but for now it's hoped this dress-down policy will help ensure patients leave hospital with their health intact. Anna Todd, BBC Look East, Bedford.
So that's what one hospital is doing. We'll be asking for your views in a minute.
Earlier this afternoon I spoke to the top man on infection control at the Department of Health. But first, here's Alex Dunlop on the never-ending fight against superbugs.
Stuart, Pseudomonas, C. difficile, MRSA, the fatal superbugs which are headlines for the papers and a headache for hospitals. 16-year-old Sarah King from Peterborough nearly died following an appendix operation after she was infected by the Pseudomonas bacteria.
Her stomach swelled up to over 42 inches. When they made her get up and walk, there was just this awful smell and fluid just pouring from her. It was just really, really bad.
Well, just last week, these 5 hospitals were named as having poor standards of infection control. Almost every week there are now new initiatives to fight hospital infections. But do they work? The Prime Minister has vowed that all NHS hospitals would be deep cleaned to rid them of superbugs. In Ipswich, they've just opened an isolation ward to stop the spread of C. diff. The bug killed 18 patients at the James Paget Hospital alone. Broomfield Hospital in Chelmsford recently showed off its new state-of-the-art sterilisation unit for surgical equipment. Infection rates at the Norfolk and Norwich have halved after an intensive cleaning programme. Some have gone back to the past. In Basildon, they brought back matrons to make a difference to cleanliness. And the East of England Ambulance Service has a dedicated depot to keep its vehicles clean. Well, scientists have also joined the fight against superbugs. The Specialist Burns Unit in Chelmsford is about to trial this air disinfection machine. It reproduces what's called as hydroxyl radical particles, in effect fresh air, designed to kill almost all bacteria nearby. But that idea, like all the others, is designed to work alongside good basic hygiene and not replace it. Stuart.
Alex, thank you very much indeed. Well, earlier this afternoon I spoke to the top man at the Department of Health on controlling infections, and I asked him first of all whether just a change of uniform would make any difference.
Well, most healthcare staff in hospitals do actually wear a uniform, nurses and other clinical staff. It's mostly the doctors who in this country have not worn uniforms traditionally. And what we're saying there is that they should be dressed in a professional way, a way in which they can deliver good, safe clinical care. And basically that means having short sleeves so that the forearms are free, not wearing anything around the wrists, wrist jewellery, wristwatches and so on. Not because those things in themselves are particularly dangerous, but they stop you doing proper hand hygiene, stop you washing your hands or using the alcohol gel properly. So it's doing that. And again, for doctors, not wearing ties that can get in the way of what you're doing when you're delivering clinical care.
The Prime Minister said recently that he wanted a deep clean of every ward. Well, shouldn't those wards be clean anyhow?
Yes, there's been a lot of emphasis on cleaning of hospitals, and there is no doubt hospitals should be clean. That is full stop. Now, because of concern, the Prime Minister announced that there would be a major, as he said, a deep clean of the hospitals. One of the important things then is, having done that, to maintain it, because this should be an ongoing programme of cleaning throughout the hospital and throughout the healthcare service generally.
Are hospitals as clean now as they were when they were cleaned by hospital staff?
It's a very mixed bag. We've had a look at whether hospitals are cleaner if they've got their in-house staff or external contractors. There's no real correlation between that. What matters is that the control that there is from the matrons and from the sisters in charge of the wards, are they getting the service they want? And whoever's employing them, are the cleaners actually part of those ward teams? Are they part of the hospital team, the hospital staff? And I've seen it work both ways. They can either be employed by the hospital or by outside contractors and still be very much part of that team. For example, they might have their pictures on the ward alongside the other clinical staff. It's that sort of element to get them really involved.
Professor, thank you very much.